Good evening, friends. Meeting after a gap of 2 days. We'll start with today's session. Yes, what we are discussing is nothing but the treatment of one-sided diseases, and out of which the treatment of local maladies, which we are discussing. Hahnemann, for the sake of understanding those local maladies, he has tried his level best to first differentiate local maladies into two varieties, those which are caused because of external causes and those which are caused because of internal causes. The homeopathic management of external causes of local maladies relates with the auxiliary measures plus the surgical measures and lastly, if needed, the homeopathic medicine. The approach was very clear in his mind, and that's why it's too easy to go with how to manage all those cases. But the second variety, which is very important than the first one, that is the local diseases caused due to some internal cause, that is internal dynamic derangement. And that's what. So, for treating those, he has tried his level best to explain all pros and cons. He explains over there, you have to take into consideration the whole case taking, the details of the patient, the present totality, along with the past totality, how the disease has started. So presenting features along with the previous original subjective symptoms gives you a totality, and on the basis of which it is possible to grasp the totality, and along with the few important things, how to investigate a fundamental cause, those details which have been mentioned in the aphorism number 5, that those also one has to take into consideration. And after that, you have to find it out right remedy constellation. And then he has concentrated on one thing, whether that disease is caused because of psoriatic miasm, whether it is because of psychotic miasm, or whether it is because of syphilitic miasm. Whatever may be the cause of the disease, it should be treated internally only. The primary manifestations of the miasms should not be treated locally. The primary manifestation of psora is the psychosis, pigwarts or leukorrhea, the syphilis, the primary chancre. All those manifestations appears on the surface and nature tries to throw it on surface. One should not treat it locally because they are related with the whole human being and they are caused because of the internal derangement of vital force due to some internal dynamic disturbance. It should be treated by any means slow internal homeopathic medicine and by not by local means. And this is what he has specifically focused while explaining the homeopathic management of those. We have reached up to the 204. The last one, which is necessary to be understood, related with this local maladies, the big aphorism along with footnote, which we have to learn. And today we'll finish that session, in today's session. 205. The homeopathic physician never treats one of these primary symptoms of chronic miasm, nor at one their secondary affections that results from their further development by local remedies, neither by those external agents that act dynamically, nor aid by those that act mechanically, but he cures in cases where one or other appears only the great miasm on which they depend, whereupon its primary as also its secondary symptoms disappear spontaneously. But as this was not the mode pursued by the old practitioners who preceded him in the treatment of the case, the homeopathic physician generally, alas, find that primary symptoms have already been destroyed by them by means of external remedies, and that he has now to do more with the secondary ones. That is, the affections resulting from the breaking forth and development of those inherent miasms, but especially with the chronic diseases evolved from the internal sura, the internal treatment of which, as far as single physician can elucidate it by many years of reflection. observation, and experience. I have endeavored to point out in my work on chronic diseases to which I must refer the reader. So, what he has explained? He has explained very clearly what happens when you deal with such types of one-sided disease. One-sided diseases always produces the primary symptoms specifically presents on the external most aspects of the body. So sora expresses in the form of a itch or scabies, a vesicular eruption. The psychosis expresses it in the form of a pigworts or condylomatous, along with the venereal leucorrhea discharge. Again, external manifestation. And third one, the syphilis expresses either single painless hard ulcer, either on male or female genitalia. Again, a external manifestation. All three manifest themselves on the external most aspect. Old school always considers them as a local disorder. They consider it is a local disorder, should be treated locally. And that's why they try to treat them with the only local means. So they try to apply local ointments for psoriatic itch. They apply the mercurial preparations for the syphilis. They uses cauterization or surgical removal of the condylomatous. And what happens once you try to remove it on the surface by local means, it enters inside. And when it enters inside, it used to produce internal manifestation to which we label by the name of secondary manifestations of miasm. Those secondary miasms with which generally patient approaches homeopathy. Very occasionally we get a clear picture of primary symptoms of those disorder, but generally we get clear cut secondary manifestations of the disease. We get a case of for example, a case of epilepsy, a case of ascites, a case of liver cirrhosis, a case of heart disorder, and all those are secondary manifestations of the suppressed miasms. And when you have to deal with it, then you don't have a primary symptoms because those are lacked, those are vanished, and what remains is the secondary. Here, the homeopath has to find it out how the disease has evolved. He has to take into consideration the whole ODP. Since when the patient has started the disorder, right from that day till today, how it evolved. You have to go in to find it out whether is there any history of suppression of the miasms in the past or in the family history. That's what you have to catch. And all those things are very important from your point of view. And if you are able to understand them, then and then you can get a right remedy. Otherwise, you miss the remedy. Once you miss the miasm, you miss the remedy. And for that purpose, he explains over there that if he has mentioned that these are the products of Sora, but these are not only the products of Sora. During Hahnemannian time, yes, his sentence was true. Because at that time, the 7/8 cases were of a Sori and only 1/8 cases of other miasm. Now we we have exactly the opposite. We have maximum cases of mixed miasmatic traits, nearly about 7/8 of the mixed miasmatic trait, and very few Sori. The era has changed. Within 200 years, the inherited miasm developed and it has mixed. And that's why we have to reach to the find it out a right remedy for the that mixed miasmatic trait. You have to take into consideration the complex miasms and you have to find it out a remedy which covers that complex miasm. Then it is possible to reach to the right remedy and you can treat. But if you are treating such secondary symptoms with the help of homeopathy, you can treat them only and only by internal means. You have to give the remedy, whether it is primary symptom of the miasm or whether it is a secondary symptom of miasm, you have to give them internally. And this is what he wants to focus over there. But there is one exception, which he has mentioned in the footnote. And that also we have to finish in today's session. See what he says regarding the in this footnote number I think 118. I cannot therefore advise, for instance, the local extirpation of the so-called cancer of the lips and face, the product of highly developed sora, not infrequently in conjunction with syphilis, by means of arsenical remedy of Prairie Cosme, not only because it is excessively painful and often fails, but more for this reason. Because of this, dynamic remedy should be indeed succeed in freeing the affected parts of the body from the malignant ulcer locally. The basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of the great internal malady to some more part, as is done as it does in every case of metastasis, and consequence is blindness, deafness, insanity, suffocating asthma, dropsy, apoplexy, etc. When he was writing this footnote, this footnote is related to the people who used to apply the homeopathic dynamic medicine locally. There are people who tried that they used to give the local homeopathic medicine at the same time internal homeopathic medicine. Hahnemann says there is a problem if you use those dynamic medicines externally. If he has given simple example of a cancer of lips. If remedy is arsenic and you give the arsenic to the patient, at the same time you apply the arsenic on the lips. He says over there, it is not because it causes burning over there, but he says that if that arsenic works over there externally and remove the ulcer, you will be deceived. You don't understand thereafter whether patient has cured or not cured, whether his internal miasm has treated properly or not treated, because that was the only indication on the basis of which you diagnosed the miasm, on the basis of which you understood that person is diseased internally at the dynamic level. And if you remove it by local means, then you are nowhere. Then there is no further thing on the basis of which you will understand whether the internal malady is cured or not. And if it never gets cured, then it definitely produces metastasis. Then it enters into the brain, then it enters into the ears, then it enters to somewhere in the kidneys, in the heart, and produces their disorders. The list which he has mentioned over there in the form of deafness or in the form of insanity, the suffocative asthma, the dropsy, the apoplexy. These are the secondary manifestations or metastasis which can happen if you treat it locally. And for that purpose, he says, those disorders should not be treated locally, even though you are treating it on the homeopathic principle. He was very sure regarding the homeopathic treatment of those disorders only on the internally and on the basis of law of synergy. What he says further, but this ambiguous म्हणजे संदिग्ध, which is not firm, not confident. But this ambiguous local liberation of the part from the malignant ulcer by topical arsenical remedy only succeeds, after all, in those cases where the ulcer has not yet attained any great size, and when the vital force is still very energetic, but it is just in such a state of things that the complete internal cure of the whole original disease is also still practicable. So he says, if remedy is arsenic, you must give it internally only. You should not apply it locally. You should not give will apply it locally and remove the external symptom. If the remedy is arsenic and if it is perfect simillimum, it will first cure the internal malady. And once the internal malady is cured, automatically the ulcer on the lips will start disappearing. It disappears forever and there will be no further progress of the disease or no further recurrence of the disease. But unless and until you give it internally, you cannot understand. And then he further says in the same footnote, The result is the same without previous cure of inner miasm. When cancer of the face or breast is removed by the knife alone, and when encysted tumors are inoculated, something worse ensues, or at any rate, death is assured. So if you remove breast cancer, if you remove, for example, the cancer or tumors on the face by the surgical measures, by removing them surgically or by radiation, by chemotherapy, it will definitely will going to produce harm. It will not cure the disease. And there is no cure which happens because of it. So death, death is hastened. Very important word. I have a case today only. I want to share that. I'm treating one case of very severe heart cancerous affection of the right breast of the patient. It is so hard and so big, and already it was inoperable. She has taken first the opinions over there. They asked that we'll do chemo, but it will not work. Already it is very big tumor with metastasis, and they refused. In fact, patient also refused, and patient was brought to me since last nearly about 1 year. Yes, it is increasing, but the lady was not able to do work, not able to do household activities. Now she is doing all her activities. She was a daily wage worker and she goes for work with that big heart tumor. See, this is the difference. Even though disease is increasing over there, but she survived. It was told to her that she will not survive. It is already so much of one is a big period given by homeopathy without using a knife, without using the chemotherapy. And she is, in fact, she is able to function. So this is too important that one has to understand the disorder and accordingly work. And this is what he wants to do. If you remove them, then death is definitely absent. Then there will be speedy metastasis. This has been the case times without number. But old school still goes blindly on the same way in every new case with the same disastrous result. And this is how the old school goes. They used to remove it surgically, then apply the radiotherapy, then apply the chemotherapy, and all those things they goes on. And it affects the human life and the death is as so he has criticized about it over there. And one more footnote to this paragraph is there. It is only for the word related with the primary manifestations of the three miasms. Each eruption is the Sora, the Shankar Vivo is the syphilis, and condylomata is for psychosis. So footnote number 119, they are the primary manifestations of three miasms. Sora, each eruption, syphilis, Shankar or Vivo, and condylomata is psychosis. From 206 aphorism, the treatment of rest of the chronic diseases starts, and he explains over there how to approach with the chronic diseases. 206 to 209 related with them, and thereafter he starts with the mental diseases. So we'll not tomorrow, we'll meet on Monday and we'll start with the treatment of chronic diseases. Go through the aphorisms again so that you can understand them in a better manner. Read it again. If you don't understand, listen the video again. And still you have doubt, you can ask me anytime. So that's all for today. If there are any queries, we can have. Otherwise, we'll stop. So any
Hello,
questions? Yes.
sir. Are delusions and dreams same or are they different?
They are the different expressions of the same thing. It is one important thing. What is a dream? Dream is the reflection of the subconscious human mind. When you are sleeping, at that time, the conscious control is gone. Whatever you have suppressed generally in daily routine, where you have a conscious control. If you want to dance, you can't because you are a doctor. There are many restrictions, and those things generally reflects when the subconscious control is lost, and it is a reflection of your mind, the internal feelings. Delusion is also one of the reflection of your internal feelings. So they are very close to each other, reflects in a different manner. So dreams reflect generally in the form in the sleep. Delusion generally happens when you are awake. Only thing is that it is a different way of expression of the human brain. Is it okay?
Yes, sir. Thank you.
Okay. Anything else? So we'll conclude today and we'll meet on Monday with the treatment of chronic diseases. And we have to discuss many more things while discussing the chronic diseases. Okay. Thanks a lot.